Hello, everyone, and welcome to Addressing the COVID-19 Crisis, our open forum webinar series for pharmacists. Happy New Year to everyone. It's exciting to see 2021 at the bottom of our opening slide, kicking off this new year. We definitely have had a lot going on in the world of pharmacy and COVID since we last met in mid-December. I hope that you and your families had good holiday rest. I know, though, for most pharmacists, there was no rest, that it's been a very, very busy time of vaccinating, with vaccine hitting the markets and many of you beginning your immunization activities in mid-December. Well, we're excited today to be talking about, again, the vaccine topic. It seems to be the hottest topic related to COVID right now, and one that's garnered a lot of interest in our profession. So we will talk about vaccine logistical considerations, the implementation strategies, key information about immunization, and other factors that facilitate vaccine administration. Our featured speakers today are pharmacists who are actually doing this in real practice, including Dr. Gretchen Garofoli, who's the Associate Professor in the Department of Clinical Pharmacy at West Virginia University. She is working at the Waterfront Family Pharmacy in Morgantown, West Virginia. She coordinated is the coordinator currently of the APhA APPM Immunizing Pharmacist SIG, a graduate of University of Pittsburgh School of Pharmacy, and completed a community-based residency with Virginia Commonwealth University. And Gretchen's been part of a team that has been tasked with immunizing long-term care residents across the state of West Virginia. They've had some tremendous success with that, and we're going to hear from her firsthand about how that effort has gone in immunizing long-term care facility residents. We're also pleased to be joined today by Dr. Cody Sandusky. Cody is the Director of Pharmacy at the Harrisburg Medical Center in Harrisburg, Illinois, and he's the President of the Illinois Pharmacists Association. Cody got his PharmD from SIU Edwardsville School of Pharmacy, and in addition to working with APhA, he serves on SIUE's Pharmacy Advisory Board and also on the Harrisburg Medical Center Foundation's Board of Directors, and he's a past member of the APhA Foundation Board of Directors. Now, Cody brings a unique perspective to our discussion today because the Harrisburg, Illinois Medical Center was one of the first rural hospitals in the United States to receive COVID-19 vaccine, and Cody was the pharmacist that was in charge of receiving that and beginning to immunize their employees. And so we have today the two pharmacists, two of the pharmacists who are among the very first in the nation to begin immunizing healthcare workers with COVID vaccine. So we're excited to get to hear from them. Of course, we have also with us today our regular subject matter experts from APhA staff, including Mitch Rotholz, who's Chief of Governance and State Affiliates with APhA and the Executive Director of the APhA Foundation. Mitch works very closely with the immunization community broadly at the national level and has for many decades, and we're going to lean on Mitch for his immunization specific information related to policy. We also have joining us today Dan Zlot, who's the Senior Vice President of Education and Business Development. Dan had a 10-year career with the NIH prior to coming to APhA, doing oncology work and immunology work, and he's our resident clinician. If you have clinical questions related to COVID-19 beyond vaccines, we're happy to take those questions, and we'll give those to Dan today to be able to answer during our open Q&A period. And last but not least is Elisa Bernstein, our Senior Vice President for Pharmacy Practice and Government Affairs at APhA. Elisa had a 30-year career with the FDA in great service to FDA, and she will answer our legal regulatory questions that we have come up today, and we'll also share updates with you about what's going on at the federal level. So what we will do today is do a brief interview of our two guest featured panelists. and then we'll have an open forum. We have already received a number of questions prior to today's webinar from attendees who wanted to have their questions answered, so we've got those. If you have questions, please start entering them now into the questions box. We'll receive your questions and we'll answer those throughout the webinar today. We'll get to as many of them as we possibly can, so go ahead and get your questions in early, and we'll take as many of them as we can. We will not be unmuting lines today. We'll be just, in order to answer as many questions as possible, given our large attendance today, we'll read the questions out directly to our panelists and give them an opportunity to respond to your questions. I want to point out today's webinar is being recorded, so if you have colleagues who were not able to join today, they'll be able to go to pharmacists.com in the COVID-19 resources section and be able to access today's recording. It'll be available sometime tomorrow, as well as the slides from today's program. And of course, for those of you who are live today with us, you're able to click on the handouts tab in the GoToWebinar control panel, and you can download the PDF of the slides. All of the links in the PDF are active, and you can actually navigate directly to our resources that we've referenced for you throughout the slide presentation. We'll also be engaging you in conversation and polling and all of those sorts of things throughout the webinar today, so be sure to pay attention so we can get through the material. We want all of you to be fully engaged in the conversation, and we want to hear your experiences. So if there's something that our guests today say that spurs something, well, I had this experience or I had that experience, please type it in the question box and share your experiences with us, because I would like to read those out, and so that everyone can hear the benefits of your experiences today. Very, very important. So with that, let me ask Gretchen and Cody if they will join me on camera. We're going to jump right into all of our questions that we have today. So Cody, welcome. Gretchen, welcome. Thanks for being with us today. All right,
Thank you very much.
Both have you unmuted? Just want to make sure. That's great. Okay, well, Gretchen, I want to start with you. I think we have some pictures of Gretchen's practice here, so I'm going to have the staff go ahead and pull up Gretchen's practice pictures for us. I would really like to just jump in here. You and your colleagues have been involved in this massive effort to immunize West Virginia's long-term care facility residents and staff against COVID, a Herculean effort. And in fact, I heard rumor that West Virginia may be the first state to have completely immunized its long-term care population because of your efforts. Tell us a little bit about your planning and implementation to start with. So there's lots of great pictures of you guys here doing, but tell us about the steps before doing.
Yeah, so it's been an amazing experience, Michael, and we have gotten our start from Dr. Krista Capehart, who's a fellow APhA member, and she has been working at the state level to really partner the state with pharmacies that are out in the communities. West Virginia being a very rural state, we wanted to ensure that our patients in all areas got access to the vaccine. So we started planning the weekend that the first vaccine, the Pfizer vaccine, was approved, and we had, my husband jokes that I was on webinars that entire weekend with state level folks planning that implementation process. So our vaccine arrived on site that following Tuesday morning, so December 15th, and we're out that afternoon. Within 2 hours of it being delivered from the National Guard, our team was at the site immunizing those in the long-term care facility. And it was my pleasure to vaccinate the first patient who had been diagnosed with COVID in the long-term care setting in West Virginia. I was the person to vaccinate her. So that was a wonderful experience, and our team has just been great. We have a group text message going on, and we really plan a lot of the logistics that way to ensure that we have vaccinators, because there have been instances where we've had to move the start time a little bit, and it's just been great. We call ourselves the COVID conquerors, so shout out to any of them who are watching today, and they're they're all great with really getting out there and ensuring these doses are administered to patients. Also, this has been my life for the past few weeks, and it's been wonderful. And I even have earrings now, thanks to my sister, that are coronavirus themed, so that I am well prepared for all of my future clinics. But it did take a lot of planning. We made sure everybody was on the same page. In the background, I've also been getting students to go out and help some of our community pharmacists immunize now that we have moved on and we are doing the educators. And so everybody is just so excited. This is something that we've never been a part of before, and everybody is more than willing to volunteer their time. I've had students that have found coverage at their paid internships to come help me by volunteering, and it's been wonderful, and it's great to see all of us pulling together to be successful. And yes, we were the first state to have all of our nursing homes vaccinated, and I actually did my first second dose clinic yesterday at the first nursing home we vaccinated, and everything went smoothly, and it's been wonderful.
Gretchen, I wonder, have you had any of your recipients of vaccine that have had a serious anaphylactic reaction that you've had to respond to?
I'm going to knock on some wood here on my desk, but no, we have not had any severe reactions. We've had a lot of sore arms. We've had some overall general soreness. We've had some headaches, but that has been the majority of the reactions that we've seen. And at this point, I've given, or the clinics that I've been a part of, we've given over 700 doses.
Okay, great. That's good to know. All right. Well, Cody, we've got some photos of your practice as well there at Harrisburg Medical Center, Harrisburg Hospital. You know, as I said, you were one of the first rural hospitals in Illinois, and in fact, one of the first rural hospitals in America to receive vaccine. Tell us about how rural your hospital is. Where exactly is your hospital in Illinois? Illinois is a big state. Tell us about how rural it is and about the size of your hospital.
Sure. So we're a 71-bed acute care hospital in the southernmost part of Illinois. So to put it in perspective, we are about 6 or 7 hours away from Chicago, almost to the Kentucky-Indiana border. And, you know, it is a very remote area. We service, I believe it's 6 counties for our small hospital. So quite a large geographic region, and, you know, some limited resources. We have to transport a lot of people out quite a distance, unfortunately, just because of how remote the area really is.
So what was that like, Cody, especially just getting ready for this? I mean, realizing that the Pfizer vaccine required, you know, ultra low temperature and so forth. And I mean, how did you manage that in a rural hospital in a pretty remote area of Southern Illinois?
Sure. So being such a small facility, obviously we didn't have the capacity to get the ultra cold freezers, things like that. So the state actually sent the Pfizer vaccine, which was our first shipment. They sent that to Carbondale, Illinois, to be the central location for Southern Illinois. And from that point, the local health departments went and got it. And at that point, it was refrigerated. So we had a 5-day window to, you know, pump everything out really quickly. So the moment that we knew the vaccine was coming, you know, we put our team on standby that day, and, you know, the health department called, we're on our way. As you can see there, it looks like a little army walking down the hallway there that was ready to go. And I would say it was probably within 30 minutes of receiving the vaccine, we were rolling up our sleeves and sticking people in the arm. So we moved quickly and had them all gone within 24 hours.
Wow, that's pretty incredible. And so let me ask you both about appointment scheduling. I mean, Cody, had you already asked your hospital health system workers who wanted to be vaccinated, and so you knew who to call in and so forth? Was that process already established?
Sure. So we had done a poll about a month before we knew we were getting vaccine to kind of gauge the hospital staff's interest. At that time, only about 18% of the staff were on board with it. So that's kind of how we gauged what to request from the health department. And, you know, not knowing exactly when it was going to arrive, we had a group of people that were on standby, and that was on Wednesday whenever we got it. You know, we knew these people could stay late or they could be flexible with their schedule, and we knew for sure we would have it on Thursday. So one of our staff members went from 9 in the morning until 5 in the evening, whenever, and started scheduling people right then and there. And at that point, we only received 50 doses of the Pfizer vaccine, just because we weren't sure how many we were going to actually give, and we wanted to err on the side of caution and not waste any doses. So the way that worked, we picked the first 50 people that signed up and were chosen randomly. And then if that person couldn't make their time slot, then it just went down to the next person down the line, and they went to the back of the line, so to speak. Fortunately, we were able to get through pretty much everyone. A few didn't get it on the first round, but they were able to get it the next week. So it worked out really well.
Yeah. And Gretchen, did you use some sort of a process for getting nursing home residents and workers signed up for vaccine, or tell us a little bit about the process you used in that setting?
So the nursing homes actually were given spreadsheets from the statewide director for nursing homes, and they filled all of those out and submitted them to the pharmacy, and the pharmacy then uploaded them into the management system. So it worked really well. We did have some extra doses, and we had pharmacy staff members that were willing and able to get to the site to be vaccinated, so that we had all of the immunizers protected after we had the residents done. So we had enough doses. And we had one of the residents at the end had asked me, well, have you been vaccinated yet? And I said, not yet. We want to ensure that we have enough for all of you. And then after the fact, we'll go ahead and get vaccinated. And they said, well, that's very kind of you. And I said, we're in healthcare for a reason. We really want to take care of other people. So we were able to get our staff vaccinated, which is wonderful because we are going into multiple nursing homes. But the nursing home worked to schedule all of the patients for us.
Yeah. Okay. Well, that's great. Sounds like a true partnership. That's what partnerships are all about. And one of the things that both of you touched, I think Cody touched on it a little bit more than Gretchen, but one of the things I know that has happened is that we've got some fairly significant vaccine hesitancy that's existing among healthcare professionals. So we're not going to talk yet about the general population, but let's talk about healthcare professionals. So I think our audience knows, those of you that have joined me on a regular basis know that I'm actually at a large academic medical center in Southern California, and we have 6 hospitals and about 23,000 healthcare workers. And we've noticed that certain groups of healthcare workers have been more reluctant to be immunized with the COVID vaccine than others. Cody, you mentioned about only 17% signed up at first, but I think you told me that you did actually have an increase after those first doses came. There were more people who were then interested in receiving the vaccine after they saw that things went okay with the first group.
Correct. Can you guys hear me? Kind of cut out on me there for a second.
Gotcha.
Okay. Sorry. Yes, that is true. So once we saw the results for the 17%, we kind of went back, and one of the things on the survey were, what are the concerns that you have? Why don't you want to get the vaccine? And took a look at those responses, and a lot of them were some very common things that, we hear about. Some things might seem a little off the wall. Others were very reasonable and legitimate questions. So kind of went through that list of questions and emailed all of the department heads. I said, okay, talk with your staff, see what the concerns are, email me back, and started out by producing a frequently asked questions sheet and just trying to get everything out there at once and save myself a bunch of emails. And then kind of from that, it went into a social media campaign. 2 or 3 times a week, we've been putting up frequently asked questions and answers, and then also getting that out to the public. So after about a month of doing this, we've vaccinated about 45% of our staff and have about another, I would say 10% have signed up just in the last week. So we're almost at half of the staff since we started this.
Yeah, well, that's a good improvement,
campaign.
But still a long way to go. And Gretchen, what's been your experience with the nursing home-based healthcare workers?
So that's a great question. And so the residents have been fantastic. At the multiple nursing homes I've done, we've only had maybe 2 or 3 residents that have said they didn't want the vaccine, but the healthcare worker side is what is more concerning. So at one of the nursing homes, at least 50% of the staff members decided that they did not want vaccinated. And we volunteered to the people that were organizing it and said, please have them come talk to us. We're happy to answer any questions. We're happy to provide our contact information should they have any questions or concerns. These are the folks that are working very closely with these nursing home residents and need to protect them, need to protect their families. And so we did a second dose clinic yesterday, as I mentioned, and we did have more of the staff members that then came and they got their first dose. So I just think that we need to do more and more education because there is a lot of misinformation out there. And I think that just helping them feel comfortable, helping them feel at ease. Even when I was providing vaccinations today for some faculty and staff members, they had a lot of questions. There was some hesitancy. Some people were not thrilled about getting the vaccine, but said their family members told them they had to go do it. And so answering their questions just to ensure that they feel comfortable and they have the correct information to then go pass on to others.
Yeah, it does take time. I can speak again from firsthand experience. It takes time to address people's concerns about the vaccine. There's a lot of myths out there that have to be addressed and so forth. And I want to point out to our audience that APhA on our website in the COVID-19 resources page at pharmacists.com has several tools that you can use to help you address vaccine hesitancy issues, whether it's among healthcare professionals or the patient populations that you serve, and we'd encourage you to take advantage of those resources. Very important to do. I'm wondering, you know, Cody, hospitals were really never intended to be the mass immunizers of the community. Some hospitals are beginning to figure out ways to use their outpatient facilities and others to be able to do that. What about in your rural area? Are there other healthcare providers out there that you think will step up to provide vaccines to the community, or is Harrisburg Hospital going to have to take that role on? What's your plans there?
Sure. So for the time being, right now, it's us and then the neighboring hospital in neighboring El Dorado, and then the health department. Right now, we're trying to go through all of the healthcare personnel within our health department's 3-county district. We are planning, we've submitted the paperwork to get our outpatient clinics to be vaccine centers so we can get that. And then using any resources we can, really. We've been working with a lot of the pharmacies, preparing them, trying to get them, you know, to get all their paperwork submitted and be ready for what's to come, because, you know, being such a small facility, we really can't logistically handle it. We need all hands on deck. As I say over and over again, this is everybody's effort. So we're really relying on those other community health providers.
Yeah, yeah. And Gretchen, I know your affiliations and connections across the state of West Virginia. I'm sure that you've been involved in those next step plannings across the state in terms of more mass immunization of the community. You want to give us just some pearls on that piece of it?
Yes, so the other piece of my job that we haven't talked about is I'm also the lead network facilitator for our Community Pharmacy Enhanced Services Network here in West Virginia. So I've really been working with a lot of our independent pharmacies, primarily that are part of the network, to help them with those next steps, answering the questions they may have regarding rollout, answering questions that they have regarding logistics for large-scale clinics in their community settings. So like I mentioned earlier, we have the Board of Education clinics that are happening this week in our state to get our teachers over 50 vaccinated. So I've worked through the planning process for many of our independent pharmacies that are hosting those clinics at the different schools, and just providing them with the plan and understanding the plan for the rollout of the vaccine so that they can answer questions in their pharmacies, because they're getting calls there, they're getting calls from multiple different sources, as well as from the patients that are coming to the clinics asking, when can my brother, sister, friend get vaccinated, because they're not an educator, because they fall in the general population.
Yeah, okay, that's great. Well, and we've gotten several questions that have come in through the question box today about independent pharmacies and community-based pharmacies in general, and when are these pharmacies going to be put to work doing immunization? I'm going to ask Mitch Rotholtz to join us on camera because Mitch has been involved in a lot of the conversations that have been going on at the federal level with the CDC regarding the national effort to engage pharmacies in vaccination. And I think we may have some more recent news about that process. And so let's talk a little bit about that, Mitch. Will you help us understand how this federal allocation is working, the state involvement with it, and when pharmacies can start expecting to see vaccines arrive in their pharmacy to immunize their communities?
Yeah, good questions, Michael. So for pharmacies program, there's two phases or two components to the program. One is the federal contract program, and the other is the state-based. In Tier 1A, which is primarily your healthcare workers and your long-term care, you may recall that the government entered into a federal contract with Walgreens and CVS primarily, but some other providers are also able to do that, to provide vaccinations to long-term care entity, whether it be residents and workers in those facilities. That's a state option, whether to utilize that federal mechanism or the state to do their own system like they did in West Virginia. So that's to cover those two models. You may recall recently that ACIP and CDC identified additional tiers, 1B and 1C, to expand the access and targeting of patient populations, for example, 75 years and older, essential workers, and so forth. Those were envisioned to utilize community-based practitioners and were envisioned to occur later on in the timing of the process. A lot of what's driving this is how much vaccine is available, who are the priority targeted populations. In the federal contract that have been put in place, those were set up to start in what they call phase 2, which is when we have a larger supply of vaccine and we can engage more pharmacy providers. In those federal contracts, which were put in place to help offset some of the stress levels on the state public health departments, those included national chains, regional chains, and networks of independent community pharmacies. And so it's a broad number of pharmacies that are in those contracts. States have the prerogative to either follow the guidance, the tiers of CDC, or as we're seeing in some states, they're modifying that. For example, some have moved up administering vaccine to those 65 years and older. Well, that's put some stress on the system. That has also made it where there's a need for more community ambulatory-based providers to be activated. And the hospitals are under stress because they're also dealing with patients who have COVID. And so the feds are looking at now of allowing and setting up mechanisms for the states to tap into that federal contract now, identifying providers who are on the federal approved list so that they can be activated to serve the needs of those community ambulatory-based patients, including medical providers who are in the community who have not been immunized through the hospital health system process. So that's really where now it's up to the state health departments to identify pharmacies, and some have gone in their own system to enroll pharmacies, both chain and independent, into their networks, or to utilize the federal network and just activate them now in the phase 1B and 1C. It's a complicated picture, it's a moving target, and all I can say is make sure that if you're an independent pharmacy, that you are connected with one of your networks, you're part of one of the networks, or enrolled in your state health department's network, so that when they're identifying providers, which is what they're doing now, you're on that list to be considered for activation. Ultimately, our goal is to make vaccines available through any willing, ready, and able provider. That's the ultimate goal when the vaccine supply can support that.
Yeah, that's great, Mitch. And I want to just also give, again, a personal experience from here in California in that our county health departments are now actively reaching into the pharmacy community to begin distributing vaccine to community-based pharmacists, both independent and chain pharmacies, to begin this effort of expanding the tiers. and expanding the number of people who are immunized. So being connected to your county health department, your state health department, those are important steps in the process. And we know that there's a push now to try to increase the number of people who are vaccinated in our country. Now, I want to cover a couple of our other questions that come along. Some of these are in random order, and we'll change and jump back and forth from subject to subject a little quickly. I wonder if maybe our panelists, Cody and Gretchen, could share with us some of the most common questions that patients have been or that some of the most common questions that the healthcare professionals have been asking you related to the vaccine before they get vaccinated. So maybe that's questions about the vaccine or side effects or whatever. What's your common questions, Gretchen, that you're getting?
I've gotten a lot of questions about the side effects of the vaccine. So most of the people that we have immunized, like I said, have had a sore arm, headache, tiredness. So that's one of the things that I've been answering most frequently.
Yeah. Okay. Cody, what about you? Anything?
Sure. So we have had a lot of questions about the side effects, but one of the bigger things that people have asked has been the production timeline. You know, they think that we've seen other drugs that take years and years and other vaccines that take so long to develop. And here we are a few months later, you know, trying to roll out mass immunizations. So that's one of the more concerning things that people have asked about here.
Yeah, and I think that speed of vaccination, how quickly things have come about, is certainly a point of confusion. It can be a point of confusion. I do want to just remind our listeners that several months ago, we did actually have officials from the FDA who came on and talked about the vaccine safety process. And they talked about in that webinar, you can go back and listen to those at pharmacists.com and the COVID resources page. They talked about how vaccines are normally produced and how that timeline was able to be compressed in order to get a vaccine to market quickly under an emergency use authorization. So there are some good answers to that question, and I think we'd encourage pharmacists to take a look at that deeply and be prepared for that. Have any of you who've been immunizing noticed or had any patients complain about excessive bruising or any kind of a metallic-y taste in their mouth? That's a side effect that someone has heard, and curious to know if either of you have heard of either of those things.
I've not had any patients experience that.
Yeah.
I have not either.
Michael, I actually have a physician friend who called me that he had a reaction on the side. It was more of a rash, but wasn't bothersome, wasn't anything that was allergic, and it's been self-maintained. And then on one discussion group, there were several physicians who had said they observed a rash-like, but nothing significant that was debilitating.
Yeah, and we've given about 9,000 doses here at Loma Linda so far, and we've not had anybody complain of a metallic-y taste. That's not something I've heard of. We have had a couple of people who've had allergic reactions that we can identify, but beyond out of 9,000 doses, most everything else has been sore arms and a little fatigue. That's been primarily what we've seen. We just started second doses this week, and so we'll see what happens after second doses. This gives me an opportunity to remind everybody about the vSafe app, and I think we've got a slide on this, and this is a little out of order, so I apologize to the staff, but the vSafe app is a after vaccination health checker. Hopefully most of you are familiar with this now, that the CDC has set up. It's actually great. I used it after I got my vaccine dose. It's a CDC smartphone-based monitoring program for COVID safety. Anybody can use it. It asks you it prompts you on a daily basis to respond as to whether you've had any of a list of side effects that have occurred. And then it follows up with you on a weekly basis for a period of time. And then after you get your second dose, it reminds you it's time to get your second dose. And then it'll also do that monitoring on a second dose. We don't know at this point, because we don't have data from the CDC on what percentage of vaccine recipients have actually signed up from vSafe, unless Mitch is aware of any data on that yet. I don't think we know that yet, though. But we don't anticipate 100% of people to sign up for vSafe, but vSafe is really important in the process of being able to identify safety signals, and pharmacists should be encouraging people to download the vSafe app. And there's a QR code actually on the flyer that that the CDC has, and I might encourage those of you who are in community-based pharmacies to blow up that QR code and post it somewhere near your patient immunization area, so that patients can just take their phone and download that QR code right there in the pharmacy and get the app going while they're in their 15-minute waiting period following vaccination. So it's a good way to really make that happen. Okay, lots and lots of questions. I want to try to get to as many of these as we can. Let's talk about billing and payment. That's a big topic, okay? Cody, you're immunizing your own employees. I'm assuming that you weren't in the business of trying to bill for those to your own insurance and self-insured, but tell us, have you done any billing at the hospital level for the vaccine, or for the administration of the vaccine?
Sure, we haven't yet. Like you said, we've been doing our own people here for the last couple of weeks, 2 or 3 weeks now. And today was actually our first non-hospital healthcare personnel got vaccinated. And, you know, being in such a small town, we didn't even bother with the administration fees there, because it's just, these are our friends and colleagues, and it's a service that we're doing for them because they would do the same for us, sort of thing.
Yeah, so it's a little different, perhaps, the hospital setting. Now, Gretchen, I imagine that it's different for you because long-term care facility residents, they're all covered by Medicare, I would assume, so or most of them. So how have you handled the billing, and what's been your experience with that?
So we have billed all of the residents through their Medicare Part B coverage, and we have not had any issues. They've all been covered with the amount reimbursed that we were expecting. As far as the staff is concerned, our DHHR statewide is picking up the cost on the admin fees for those. We've done, like I mentioned, some pharmacy employees, and when we tried to bill their commercial insurance, their private insurance, it has had some rejections, and we are currently exploring why those are happening and what we can do to get coverage for those types of people.
And I want to point out to our viewers today and listeners that we have posted in the chat box a link to a COVID issue brief about what we know at APhA about payment for COVID-19 vaccines, including the Medicare Part B CPT codes that you need to use to be able to bill for COVID vaccine administration. And there's more details about that as well. For those of you who do wind up having a claim rejected for administration fees through a private insurer or others, we encourage you to reach out to your state pharmacy association. Your state pharmacy association will likely have been in contact with payers across your state, and they will also work with APhA staff to try to get things addressed. We're aware that these things pop up, and we certainly believe that pharmacists ought to be covered for the billing of these vaccines under either the pharmacy benefit or the medical benefit. That raises another question in that one of our pharmacists has asked, you know, most of the plans that they're aware of have said they'll cover the COVID vaccine administration under their medical benefit, but they've not been so forthcoming in covering it under their pharmacy benefit. Mitch, I wonder if you or any of the other staff from APhA could give us any insights into that piece. Are you hearing about that being the case, that pharmacy benefit managers may not be covering the vaccine and you have to go through the medical benefit? Any guidance on that?
And I'll ask Lisa to also join on responding to this. It's all over the board. There's a lot of discussions that are going on in terms of which system. We know that there's a strong encouragement by CMS for plans and PBMs to cover whether in-network or out-of-network providers. But in terms of which side to bill it through, it's a variable by each plan at this point. We're trying to get a better handle on the information there.
Okay. Elisa, do you want to add anything on the billing?
No, Mitch just covered at the end. We are hearing that it's all over the board, and we're doing what we can to try and make it more clear. And the resource that is in the chat room, that will be updated when we know more. So bookmark that.
Yeah, and also I want to make it very clear, COVID-19 vaccine is being provided for free to all healthcare providers who are administering the vaccine. You cannot charge for it. I think that's very, very important to make everybody clear. You can't charge for the vaccine. The vaccine is being provided. It's already been purchased by the federal government. It's being distributed under contract by the federal government to you all. There is the opportunity to bill an administration fee, but as a part of participation and agreeing to receive COVID-19 vaccine, if you can't charge the patient an out-of-pocket fee if they can't pay. We don't want to deny immunization to any person who needs to be immunized against COVID-19. Elisa, any further expounding you'd like to do on that point?
No, not right. I think you covered it too.
Good. Okay. Just want to make sure we didn't leave anything out there. Very important pieces that
Michael,
we need to do. Yes, Mitch.
One piece of information just to remind people of is that there are specific CPT codes for the different COVID vaccines and the different administrations. So use that as a guide. And also NCPDP has also come out with some coding standards for COVID vaccination.
Gretchen, a question that came in for you. Can you elaborate a little bit on the types of rejections you received from the private insurance companies you were trying to bill for workers? Were those service not covered? Was it provider not covered? What was can you elaborate, or are you sure know about it? Or
So we tried to bill a couple of claims for, like I said, the pharmacy employees, and the message that we got was ingredient cost submitted. And so that was, we didn't have a lot of information. It just said to look at correction suggestions, but it didn't really have a lot of information as far as what the issue was. So like I said, we're still trying to explore that and figure out what the issue is with that code.
Yeah. Okay. So I know there are other questions about billing, and some of it I'm just going to refer folks to the issue brief. This is still evolving. We're very early in the process of billing, especially private insurers, and getting lots of rejections, and some people are getting some coverage, but we'll continue to work through. And again, I want to reiterate, your state pharmacy associations are vital in this process, and we encourage you, if you're not a member of your state pharmacy association, you need to join. And this is one of the reasons why, because they can help you with these payment issues at the local level. Of course, APHA is working on these at the federal level, but your states can really help you with this, and we want to encourage you to do this. Okay, I want to move on to a little bit different topic. And Gretchen, all of the good that we do sometimes can get overshadowed by a sensationalized news story. And there was, in fact, some real issue with COVID antibody being inadvertently administered to patients in West Virginia. What happened? Can you just give us a little briefing on this, and how do we prevent this from happening in the future?
Yes, so we were all excited about all the good we've been doing, and then this story hits, and of course everybody is focusing on the negative, which we obviously need to focus on why this happened and what we can do to prevent it in the future. So you'll see by looking at the pictures, the Moderna vaccine, which is what the facility thought they were receiving, looks very close to the antibody with the red cap. They were not pharmacists involved, so I can put all the pharmacy folks' minds at ease. These were not pharmacists that were involved with the administration of the vaccine or what they thought was the vaccine. And it just teaches all of us that we need to double and triple check. Ever since this happened, I have reached out to student volunteers, and in my preparation documents, I tell them, you need to double check, you need to triple check. at all of the clinics we've done, we are checking each other's doses. We're ensuring when we're doing the Pfizer vaccine that we are all drawing up the right amount of the saline before we are injecting that into the vaccine. And then we double check doses as they're drawn up and as they're administered. So we have double, if not triple checks at all of our clinics. And so I think that that's what happened here. I think that there were not those checks in place, and they were administering and figured it out a little too late. A pharmacist did go and correct the error, and a pharmacist was involved with ensuring all of those patients were taken care of. So pharmacy, we were the heroes in the white coats, and we got there and we fixed the error. And I mean, we as a profession, not me personally, but one of my colleagues actually drove down a couple hours away from her hometown to vaccinate those patients that had received the antibodies. And she did that on New Year's Eve. So she went above and beyond to ensure that those patients were taken care of. So I've just, like I said multiple times, double and triple check those vials to ensure that we are administering the correct vaccine.
Yeah. So another couple of questions to move through pretty quickly. Do you keep epinephrine, diphenhydramine, et cetera, on hand in case of anaphylaxis? And I see Cody and Gretchen's heads are nodding, and I'll just tell you that the federal guidance provided by the CDC on COVID-19 vaccination clinics is very clear that you need to keep at least 3 full doses of epinephrine, and there's a whole lot of other instructions the CDC provides, and we link to that on our website. So yes, you need to have those emergency supplies on hand in your pharmacy. Is very important to do that. And this waiting around 15 minutes to be observed, how critical is that? Cody?
I mean, it is obviously something that needs to be observed. We've been telling our staff, stay within the premises of the hospital. We're a small enough facility. If something goes awry, that we can get to you quickly and get you to help quickly. If, for instance, we had a lot of people that were off today come in for their vaccines this morning. We've been having those people wait around for their 15 minutes just to be on the safe side.
Yeah, and that's what we do at our hospital. If they're going to stay within the hospital facility and be around other care providers, we let them walk away from the immunization area and be observed by their colleagues. But if they're coming off shift and getting vaccinated, we make them wait for the 15 minutes at our hospital as well. And Gretchen, I think it's probably a little easier in the long-term care facility, but as you're looking at the community pharmacy plans that you're laying out through CPESN, is that something you're planning for, waiting periods and waiting areas?
Yes, so that is something that we've done at all of the clinics that we've had. So in the long-term care facilities, we've had the benefit of having a separate room set aside with extra epinephrine in, where the patients are observed post-vaccination. They also have staff rooms as well. We've done other clinics and we've had plenty of areas where we're spacing them 6 feet apart. So COVID adds a whole extra level that we need to take the safety to ensure that patients aren't crammed around waiting for their 15 minutes and that they are spaced out appropriately. So there have been some challenges to ensure that that space is available, and we have done that. I use my husband as an example. He had very bad allergies, and he was the person I was most worried about getting the vaccine, and he fared okay. But for those patients that do have those severe histories of anaphylaxis, you want to make sure that they are monitored at least 15 minutes. I had a lady today that told me she had a very severe reaction after a previous vaccine. So after obviously asking more questions, we figured it was safe to vaccinate her, but we did ask that she wait for a half an hour to be observed. And she was very fine with that because she wanted to not get in her car and have that type of event happen. So I think we need to think about those things, and we need to ensure that there is space in our community pharmacies. And if we're scheduling patients, that they're not scheduled so tight together that you then have a backlog of patients waiting the 15 minutes post-vaccination.
Okay, well, let me also move just very quickly through a couple other questions. How was West Virginia not involved in the Warp Speed program with Walgreens? I think Mitch may have addressed that a little earlier, in that the states didn't have to participate in the federal program, and there were 2 states, I believe, that did not, West Virginia, and I don't know the other, but I think there were 2. Is that right?
Arkansas.
Arkansas was the other that had their own process for doing it. So there was a mechanism, and that's why that's been a little bit different here. Also, want to just real quickly mention that there's questions and concerns about fertility issues. There is no data on fertility issues. The vaccine is under emergency use authorization, and the vaccines are still being studied. The studies are still ongoing, the clinical trials. They won't end for a full 2 years. There's no information that we have currently that the vaccine impacts or affects fertility. There's no scientific evidence to indicate that it affects fertility. Anything that's out there is largely rumor at this point. There's no data. So it would be premature for us to comment about that here, just to say that we need to look at that. And then also, what about giving the vaccine to someone who's pregnant or breastfeeding? I would just point you to the fact that while the vaccines were not studied specifically in individuals who were pregnant or breastfeeding, the American College of Obstetrics and Gynecology, as well as the CDC, have said that women should be offered the vaccine and make an informed decision with their healthcare provider about being vaccinated. And we do know that negative outcomes from COVID in pregnancy are well documented, and there may be benefits. And we know of many pregnant women who have now received the vaccine, and as well as individuals who are breastfeeding who've received it. Okay, well, we've gotten a lot of stuff covered here. I am going to ask Mitch real quickly to cover a slide that we have on, let's see, have we covered this yet? The FDA statement, or is it Elisa? One of the two of you is going to cover the FDA statement on authorized dosing schedules for COVID-19 vaccines. If we can get the staff to pull that slide, there we are, and I'll let one of you jump in.
It's FDA, so it's Elisa.
Yeah, I'll jump in. Thank you. Yeah, a lot of you may have heard in the news and different reports of reducing the number of doses in order, or the dosing time, or changing and modifying the administration in different ways in order to get more doses. This FDA made a statement just a few days ago, very strong statement, that this should not be done, that there is no evidence or information in order that would support this. And when an EUA, the emergency use authorization, is granted, it's based on the data available at the time. And this is not the same as a full application for a new drug. So FDA likely does not have any information about these changes at this point to make a call. So do not do this. Follow the information and the dosing recommendations that are provided with the product, and that we actually have, again, going back to the information briefings and the resources that APhA has, they do specifically follow what is in the EUA for these vaccines. Do not do it. Do not change.
Thank you. That's very important. I also want to point out that when we introduced Gretchen, we mentioned that she's a key leader in our immunizing pharmacists special interest group. The purpose of that special interest group is to provide members with support to engage in discussions with policy, education, other things for immunizing pharmacists. And we'd encourage you to join this special interest group for immunizing pharmacists as a member of APhA, a very important thing to do. Cody and Gretchen, Mitch, Lisa, thank you all for joining. I'm going to cover a few more details with our audience, but we'll let you guys go and just say thanks so much for joining us today. We have lots of things always going on at APhA, and we thank everybody. I am going to do the polling question, staff. So, but before we jump into covering those things, I'd like to get a sense of where our audience is. What is the status of COVID-19 vaccine administration at your practice, regardless of where you practice? Are you already administering the vaccines? Are you planning to administer them when they come together? Are you having barriers to administering the vaccines? or are you not planning to participate at all? And there's some of you that may be still trying to evaluate the opportunity. So let's get a sense of where our listeners are in terms of participating in COVID vaccine administration. All you need to do is just take your cursor and click on the button right on your own computer screen, and we'll be able to get your response. So we get a few more people to vote, please. And hopefully we'll have a good response rate here. Good. All right, let's take a look at the results. And it's mixed across the board. It looks like about 42% of you plan to administer the vaccine when it's available, and about a quarter of you are already administering vaccine. 14% of you are facing barriers, and I just encourage you that as you're, if you're facing barriers and you need help with that, again, work with your state pharmacy association, and please reach out to APhA. We would be happy to try to help with barriers and trying to reduce those barriers. I also want to find out how many of you as frontline healthcare workers, as pharmacists, have actually received at least your first dose of the COVID-19 vaccine. How many of you have already been immunized with your first dose? And how many of you are still waiting for your dose? All right, we've gotten our responses here. And we'll give it just a few more seconds so that more of you can vote on this one. All right, and let's show the poll. And it looks like about 2/3 of you have, or 3/4 of you almost, have not yet been vaccinated with your first dose, and about 30% of you have. I just want to mention that pharmacists, pharmacy technicians, and student pharmacists were all recognized as Group 1A, Tier 1A healthcare providers. You are eligible to be vaccinated in this first tier. The states have rolled out those tiers a little differently from state to state, but I can tell you, just for example, here in California this week, we're widely trying to immunize all of our pharmacists, technicians, and students across the state of California as a part of our immunization efforts. So please reach out. If you haven't been offered immunization, proactively reach out and ask about getting vaccinated, because you do need to be vaccinated. Very important that pharmacists step up and get vaccinated to lead our communities. It's a very important piece. I also just will mention to you all that we've got quite a number of resources that are available. We'll go to the next slide, please. And one more. Some of our resources are easy to find in our legislative and regulatory update. This is a members only opportunity for you to find out what's going on in Congress and with our governmental agencies. This is released a couple times a month by our GA staff and sent out to all APhA members. So if for those of you who are members, the last one was just released on the 6th, which I think is yesterday, right? Just yesterday. So in addition to that, on our next slide, we have a couple of podcasts, Locked On Pharmacy podcasts, that myself and Steve Foster, we're the two pharmacists that are involved with the ACIP as it relates to COVID vaccine. Steve's the representative for pharmacy on the ACIP, and I serve on the COVID-19 work group. We did a podcast about a week ago or so, maybe it's more than that now, in December, on the Moderna vaccine, giving you the updates. And we had some questions today in our chat box about the way the studies were designed and how the Moderna and Pfizer vaccines are actually produced. What's the production process? There's a lot of confusion in the communities about what the ingredients are, how those vaccines are produced, and so forth. I'd encourage you to listen to both the Pfizer and Moderna podcasts, but in addition, on the next slide, we've created, through our education team, a number of vaccine resources that you can refer to in our resources at a glance. And on our next slide, a continuing education program that's specific to the Pfizer BioNTech vaccine. These two programs, these two resources also provide for you more detailed analysis about how the vaccines were produced. There is a Moderna vaccine CE that is coming soon from APhA, so that you can get even more details and also get some continuing education. So those are the things that we're working on, and we believe that this is hopefully going to be helpful for all of you as we work through the COVID vaccination process. And then I mentioned several times the Engage community. Engage is APHA's platform for pharmacists to network with each other, and we have a COVID-19 platform, Engage chat room, where you can share ideas and ask questions of colleagues across the country on how they're dealing with various things. This chat room's been very active. There's been lots of communication going back and forth. We encourage you to sign up for that at pharmacists.com so that you can be a part of those discussions as well. Now, I want to mention that next Thursday, January the 14th, at the same time and same place, we're going to offer a CE, and next week we're going to focus on the myths and facts about vaccine. We've realized that because there's so much vaccine hesitancy that exists out there among healthcare providers, that we really need to be good at discerning what's true and what's false about vaccines, so that as you as a pharmacist get hammered with questions from other healthcare providers or from patients as we roll into next phases, that you're equipped with the facts about these vaccines and can give people confident answers about the different myths that come up. If you have a myth about vaccine that you would like for us to talk about on next week's program, we'd like to ask you to go ahead and put that in the chat box now while we're still live. We'd love to receive that, and you are also welcome to just email me personally here at Loma Linda University. You can find me right on our webpage, and I'll be happy to receive your myth, and we'll try our best to try to address those as we develop the program this next week. So thank you all very much for joining us. It has been a whirlwind of a 2021. I can't imagine what the next 50 weeks are going to be like, but the first I guess 51 weeks left. See, it's going by so fast, I can't even keep up. Thanks everybody for what you do. We appreciate you. God bless.